Welcome back, everybody. Making healthcare affordable and available. It's a mantra we hear all the time, right? But while there are millions of Americans across this country who don't have access to affordable healthcare, that is changing in places like Savannah, Georgia, and also in communities all across the country. Here to talk with us more about this morning, I want you to say hello to Aretha Jones and Rena Douse of the J.C. Lewis Primary Healthcare Center. Let's give them another round of applause. Doing great work, ladies. And I want to talk about managing your own healthcare because it does seem to have many twists and turns. I want you to tell us what makes your center different and why so many people are emulating your formula to success. And you know they say imitation is the sincerest form of flattery. So what are you doing right?
The J.C. Lewis Primary Healthcare Center is committed to providing high-quality, comprehensive healthcare services. Our service delivery model improves access to quality of care. It decreases barriers for our patients, and it empowers our patients to become a partner with their healthcare provider in their healthcare treatment plan.
Rena, I want to bring you here in on this now because I know that your center began kind of as a medical refuge, so to speak, for the chronically homeless. How has it evolved into the services that you're providing today?
Since 4 years ago, we have now evolved into a community health center that are providing an array of services for the patients that consist of behavioral health care services, mental health services, and medical services for our community.
I have to tell you, it's the kids that break my heart. There are so many kids in this country who are underinsured, who are uninsured, and don't have access to proper health care. Not just children, but adults here in Savannah and all across the country. Do you see this improving given the newly mandated health care legislation reform?
Well, the 2014 legislation will expand services and care for individuals in our community that do not have health coverage right now. So more individuals will have access to health coverage. Insurance companies now will not be able to deny coverage because of pre-existing or chronic diseases. Individuals will also be able to have services at a free or low-cost reduced rate, which will increase insurance plans around the country.
Well, and certainly will help a lot of people who need access to this care. When it comes to providing health care, what would you say are the three, and I'm sure there are more than three, but what would you say are the three things that people should know or that you'd like people to know?
The top three things when I think of our healthcare center is having the opportunity to service the community. Service the community by, again, providing medical services, dental services, and behavioral health services, whereas 4 years ago, we only provided homeless services to the community.
What kind of feedback are you getting from people?
The fact of the matter is people appreciate the fact that we provide high-quality health care in an affordable and timely manner. They appreciate the fact that they're not just someone sitting in our waiting room, but we treat them as we would treat our family members.
What would you say are your most proudest moments?
4 years ago, we provided medical respite services for the homeless-only medical patient. Today, we are able to provide medical services, behavioral health services, as well as dental services, pediatric services, GYN services, mental health, pediatric care services, and radiological services. So for me, I think that's one of the proudest moments for me is to be able to service our community more.
Aretha?
I would have to say that everything Rena mentioned is now offered at our health center. 4 years ago, if we needed those services, we would have to refer out and would have to depend on others to provide that care. We now have bought all those services in-house, which allows our patient to make one trip to the facility and get all those services, which also includes case management services, transportation services, eligibility services for Medicaid and food stamps, and that's important to patients.
Lots of moments that make you proud. Ladies, thank you so much for coming by and sharing this with us this morning, and keep up the great work you're doing for the community.
Thank you.
Thank you.
All right, and if you would like to learn more about what these ladies are doing in terms of community-based, patient-directed healthcare, simply visit the website, jclewishealth.org. That's jclewishealth.org. And to find out more about healthcare and anything else that you may need to know, please visit us on our website, thebalancingact.com.
Life is like a box of chocolates.